Welcome. I am Dr. Reed. This is NICU CEO, where our goal is to provide convenient medical education opportunities for parents and medical providers. We are a brand new channel, and we want to say thank you for trusting us during this stressful time. We are committed to growing with and supporting your family. Birth asphyxia, supporting your baby in the NICU. What is birth asphyxia? When a baby is born, they need to take their first breath. This breath brings oxygen into the baby's lungs and blood. Without oxygen, the baby's cells cannot function properly and they can start to die. Birth asphyxia can be referred to as perinatal asphyxia, hypoxic ischemic encephalopathy in severe birth asphyxia, and simply as struggling to breathe for the first few minutes of life in mild birth asphyxia.
Birth asphyxia occurs when a baby does not get enough oxygen before, during, or immediately after birth. This can happen for a number of reasons, including a problem with the placenta or umbilical cord. The placenta is an organ that provides oxygen and nutrients to the baby from the mother's blood. The umbilical cord connects the placenta to the baby. If there is a problem with the placenta or umbilical cord, it can reduce the amount of oxygen and nutrients that the baby receives. This can lead to perinatal asphyxia. A difficult or prolonged delivery can put the baby at risk for birth asphyxia because it can lead to stress and exhaustion for the baby. This can make it difficult for the baby to breathe and take in oxygen. A problem with the baby's lungs. If the baby's lungs are not fully developed, it can make it difficult for the baby to breathe and take in oxygen. This can be a common problem in preterm infants, infants born to meconium, and other common newborn issues. A problem with the baby's heart. If the baby's heart is not functioning properly, it can reduce the amount of oxygen that is pumped to the baby's brain and other organs. This can lead to birth asphyxia. A problem with the baby's brain. If the baby's brain is not fully developed, it can be more susceptible to damage from oxygen deprivation. It is important to note that these are just some of the conditions that can contribute to or put the infant at risk for birth asphyxia. There are many other factors that can also play a role. When a baby does not get enough oxygen, their body starts to go into shock. This means that their heart rate and breathing start to slow down, and their blood pressure starts to drop. If the baby does not get enough oxygen for a long period of time, their brain can be damaged. The severity of birth asphyxia can vary depending on how long the baby went without oxygen. In mild cases, the baby may only experience temporary problems, such as low blood sugar or difficulty breathing. In more severe cases, the baby may have long-term problems, such as cerebral palsy, learning disabilities, or hearing loss. There is no cure for birth asphyxia, but there are treatments that can help to prevent or minimize the damage caused by oxygen deprivation.
How common is birth asphyxia? Birth asphyxia is a condition that occurs when a baby does not receive enough oxygen before, during, or immediately after birth. It is relatively common, affecting about 1 in 1,000 babies born in the United States. However, the severity of birth asphyxia can vary greatly. Some babies may only experience mild symptoms, while others may have more serious problems. Severe birth asphyxia is less common than mild birth asphyxia. Severe birth asphyxia can cause long-term problems, such as cerebral palsy, learning disabilities, or hearing loss. The top 10 causes of birth asphyxia are: prematurity. Premature babies are more likely to have birth asphyxia because their lungs and brain are not fully developed. Birth trauma. Birth trauma can occur during delivery and can make the transition from the womb to the world difficult for a brand new baby. Congenital malformations. Congenital malformations are birth defects that can affect the baby's lungs, heart, or other organs. Maternal health problems. Maternal health problems, such as diabetes, high blood pressure, or anemia, can increase the risk of birth asphyxia. Meconium aspiration. Meconium aspiration is a condition that occurs when the baby inhales meconium, the first stool, before or during birth. Umbilical cord problems. Umbilical cord problems, such as compression or prolapse, can reduce the amount of oxygen that is delivered to the baby. Placenta problems. Placenta problems, such as abruption or previa, can reduce the amount of oxygen and nutrients that are delivered to the baby. Sepsis. Sepsis is a serious infection that can affect the baby's ability to provide blood and nutrients to the brain and body. Blood loss. When the baby's blood volumes are low, it can impact delivery of blood to the brain. Unknown causes. In some cases, The cause of birth asphyxia is unknown.
What are the signs and symptoms of birth asphyxia? The signs and symptoms of birth asphyxia can vary, depending on the severity of the condition. In mild cases, the symptoms may only last for a few minutes or hours. In more severe cases, the symptoms may last for days or weeks. With severe birth asphyxia, some complications can become permanent. Some common signs and symptoms include: signs and symptoms of mild birth asphyxia: low heart rate, low blood pressure, slow breathing, blue skin, limpness.
Signs and symptoms of moderate birth asphyxia can include all of the signs and symptoms of mild birth asphyxia: difficulty feeding, poor muscle tone, increased muscle reflexes, irritability, seizures.
Signs and symptoms of severe birth asphyxia can include all of the signs and symptoms of mild and moderate birth asphyxia: brain damage, cerebral palsy, learning disabilities, hearing loss, vision problems, seizures.
Treatment for mild birth asphyxia. For mild birth asphyxia, it usually does not require any treatment. However, the baby may need to be monitored in the NICU, neonatal intensive care unit, to make sure they are doing well. Doctors use a variety of methods to monitor infants with mild birth asphyxia. These include heart rate and respiratory monitoring, as well as oxygen saturation, SpO2, levels. Heart rate monitors allow doctors to track the baby's heart rate and rhythm, ensuring that it is within normal limits and that the baby is receiving adequate blood flow. Respiratory monitoring helps doctors determine how much oxygen the baby is receiving and if their breathing is sufficient. Oxygen saturation, SpO2, monitors measure the amount of oxygen in the blood, which can be an important indicator of how well the baby is doing. It is possible that extra oxygen and/or medications may be given if needed. If your baby has been diagnosed with mild birth asphyxia, it is important to talk with your doctor about all available treatments and monitoring options for you and your baby.
Treatment for moderate birth asphyxia. One of the most common treatments used to treat moderate birth asphyxia is oxygen therapy. Oxygen therapy involves supplying additional oxygen to the baby either through a mask or an endotracheal tube. This helps the baby maintain proper oxygen levels in the blood and can help improve their breathing. Other treatments may include medications such as diuretics, vasoactive drugs, surfactants, and other respiratory medications to help improve the lungs' ability to absorb oxygen. In some cases, ventilation with a mechanical ventilator may be necessary if the baby is unable to breathe on their own. This is done by inserting a tube into the mouth or nose that connects to a ventilator machine that helps regulate breathing patterns. Finally, it is important for doctors to monitor any changes in heart rate, breathing patterns, and oxygen saturation, SpO2, levels in order to determine if treatment should be adjusted or modified accordingly. With proper treatment and monitoring, most babies with moderate birth asphyxia will make a full recovery without long-term effects or complications.
Treatment for severe birth asphyxia. Severe birth asphyxia is the most serious type of birth asphyxia. It can cause long-term problems, such as cerebral palsy, learning disabilities, or hearing loss. Treatment for severe birth asphyxia may include the treatments for moderate birth asphyxia, as well as additional treatments. In some cases, babies may need to be placed on a ventilator or even therapeutic hypothermia. Other treatments may include medications and nutrition support. Indications for therapeutic hypothermia for birth asphyxia. Therapeutic hypothermia is a treatment that involves cooling the body temperature of a baby who has experienced birth asphyxia. It is used to reduce the risk of brain damage. Therapeutic hypothermia is indicated for babies who have had severe birth asphyxia and who have signs of brain injury. In conclusion, birth asphyxia can be mild, moderate, or severe, depending on the severity of oxygen deprivation experienced by the baby at or near the time of delivery. It is important for parents to understand that early diagnosis, treatment, and monitoring are essential in order to help their baby have the best outcomes.
Overview of therapeutic hypothermia for birth asphyxia. Therapeutic hypothermia is usually started within 6 hours of birth. It is usually reserved for babies whose birth asphyxia meet qualifications for therapeutic hypothermia. The baby's body temperature is cooled to 33.5 degrees Celsius, 92 degrees Fahrenheit, for 72 hours. The baby is then slowly rewarmed to their normal body temperature. When a baby is in the NICU for birth asphyxia, the doctors use special equipment to lower their body temperature. It is called whole-body therapeutic hypothermia. A blanket with cold liquids will be used to help cool down the baby's body. A temperature probe is used in the esophagus or rectum to closely monitor the temperature at all times during the procedure of therapeutic hypothermia. The goal of therapeutic hypothermia is to help protect their brain from any secondary damage that may happen due to not having enough oxygen during delivery. Why do we use therapeutic hypothermia for birth asphyxia? Therapeutic hypothermia can help to protect the baby's brain from further damage and give them a better chance of full recovery. The goal of therapeutic hypothermia is to prevent secondary injury. Secondary injury is damage that occurs to the brain after birth asphyxia. It can be caused by a number of factors, including inflammation, free radical damage, and cell death. Therapeutic hypothermia helps to reduce the risk of secondary injury by slowing down the body's metabolism and reducing inflammation. Therapeutic hypothermia is a safe and effective treatment for babies who have experienced birth asphyxia. It has been shown to improve neurological outcomes, including cognitive function, motor skills, and vision. How long will the infant require that treatment? Therapeutic hypothermia is usually started within 6 hours of birth and continued for 72 hours. The baby will need to stay in the hospital for the duration of the treatment. Therapeutic hypothermia is a continuous treatment. The baby's body temperature must be monitored closely and adjusted as needed. The baby will need to stay in the hospital for the duration of the treatment.
What are the long-term effects of birth asphyxia? Most babies who experience birth asphyxia make a full recovery. The frequency of each complication with severe birth asphyxia varies. Cerebral palsy is a commonly thought of long-term complication of severe birth asphyxia, affecting about 20% of babies who experience this condition. Some of the most common complications include learning disabilities. Learning disabilities occur in about 50% of babies who experience severe birth asphyxia, hypoxic ischemic encephalopathy, HIE. Hearing loss. Hearing loss occurs in about 4% of babies who experience severe birth asphyxia. Vision problems. Vision problems occur in about 7% of babies who experience severe birth asphyxia, hypoxic ischemic encephalopathy. Seizures. Seizures occur in about 10 to 20% of babies who experience moderate or severe birth asphyxia. Some of the protective factors for your baby could include: the baby is born at term. The baby has a normal birth weight. The baby does not have any other health problems. The baby responds well to treatment.
How can I support my baby who has been affected by birth asphyxia? If your baby has been affected by birth asphyxia, it is important to provide them with love, support, and care. You can do this by spending time with your baby and talking to them, getting involved in your baby's care, touching and cuddling your baby, if the medical team feels it is safe, breastfeeding or bottle feeding your baby when they are able, talking to your baby's doctor about their progress. By providing your baby with love and support, you can help them reach their full potential. Coping with a baby in the NICU. If your baby has to stay in the NICU, it can be a very difficult and stressful time for you and your family. There are a number of things you can do to cope with this experience, including: ask questions. Don't be afraid to ask the doctors and nurses questions about your baby's care. The more you know, the better you will be able to cope with the situation. When the medical team complete medical rounds, it can be intimidating to speak up or ask questions. It is common to forget the questions that have been keeping you up all night. Many parents find it helpful to write down questions on a notepad or a phone. Get involved. The more involved you are in your baby's care, the better you will feel about the situation. Ask the doctors and nurses how you can help. It can be an intimidating experience to have your baby monitored by a variety of wires and tubes, but you are not alone. Don't hesitate to ask for help if it feels overwhelming. Courage is the key. Prioritize yourself. You are the most important person to your baby, and they want a healthy and happy parent. Self-care is one of the best things you can do for them. Make sure that you're eating nutritious meals, getting enough sleep, and staying active. By taking care of yourself during this time, You will be able to provide optimal support for both yourself and your infant. Talk to your family and friends. Talk to your family and friends about how you are feeling. They can offer you support and encouragement. Find a support group. There are many support groups available for families of babies in the NICU. These groups can provide you with support and information.
Where to find more information about birth asphyxia? There are a number of resources available to help you learn more about birth asphyxia. These resources include March of Dimes. The March of Dimes is a leading non-profit organization that works to improve the health of babies. They have a comprehensive website with information on birth asphyxia, including causes, symptoms, treatment, and resources for parents. American Academy of Pediatrics. The American Academy of Pediatrics is a professional organization of pediatricians. Their website has information on birth asphyxia for parents, including what to expect after your baby is born, how to care for your baby, and how to get support. National Institutes of Health. The National Institutes of Health is a government agency that conducts and supports medical research. Their website has information on birth asphyxia, including causes, symptoms, treatment, and research studies. The Bump. The Bump is a website for parents-to-be and parents. They have a section on birth asphyxia with information on causes, symptoms, treatment, and resources for parents. Baby Center. Baby Center is a website for parents and expectant parents. They have a section on birth asphyxia with information on causes, symptoms, treatment, and resources for parents. These are just a few of the many websites available to parents whose infant experiences birth asphyxia. It is important to find a website that provides accurate and up-to-date information, and that is supportive and understanding. By learning more about birth asphyxia, you can better understand your baby's condition and provide them with the best possible care. When your newborn is in the neonatal intensive care unit, it can be an overwhelming experience. But you don't need to go through it alone. We are here to provide support and guidance. This channel is about providing guidance, resources, and hope for parents whose babies are in the NICU. In each video, I'll share my experiences from years of working with families going through this challenging time. My goal is to help give you strength so that you can gain a sense of control and get the most out of these important moments together. This is a brand new channel. So I want to say thank you for your support.